Hello once again. My name is Mike, and in part two of my Aquablation procedure, I'm going to talk about the days leading up to my procedure and the procedure itself. So as I said before, I had about a 3-month wait before I was scheduled in for my procedure. My procedure was going to take place on March the 19th, 2022 at 8:30 in the morning. In those weeks leading up to the procedure, I did a lot more research on aquablation. I read a few more studies, some more journal articles, and everything looked to be good. And I was pretty confident in my choice to do the aquablation procedure. As it got closer to the time, I was surprised how relaxed I was. I was pretty well resigned to doing the procedure and was feeling fairly calm. In fact, I was kind of looking forward to the procedure and just wanting to get it over with and start the healing process and see how I would do following the procedure. So about 10 days or so before the procedure, I had an appointment to go in and see Dr. Kriteman's PA, is a physician assistant at the Georgia Urology office in Roswell. Dr. Kriteman said that he was going to do the pre-op evaluation, give me some paperwork to fill out and some paperwork to sign, and also he was going to do some ultrasounds of my prostate, and just to make sure that it was all mapped out and ready to go on the date of the procedure. So about 10 days before the procedure, I went in to see him in the morning. He came into the room. First, his nurse talked to me, had me sign some papers. The PA's name was Clint Manley. Clint Manley, the PA, was very nice, very friendly, very outgoing. Sat down, talked to me about the procedure, told me he was going to give me 3 medications. The first medication was going to be an antibiotic. I was supposed to take it twice a day, 12 hours apart, one in the morning, one in the evening, and that would help to keep any infection from flaring up. And it was only, I think, about a 5-day course of antibiotics. The second prescription he told me about was called Urology Blue. He told me that it was probably a fairly expensive medication right now, but that I could look at the GoodRx and check with my insurance company. Maybe I could get it at a better price. But he said that this medication would alleviate any burning sensation that I might feel and do some other things that might help me. But he said not everybody needs to take that medication, so it was up to me whether I wanted to fill it or not. There was an over-the-counter alternative that I could take. It was called ASOS, A-S-O. He said that it was much cheaper because it was over-the-counter. You could get it at any pharmacy. It would also help to alleviate the burning. It wasn't quite as good as Urology Blue because it didn't do some of the other things that it did. But that, it might be a good alternative to take instead of paying for that expensive prescription. The third prescription he gave me was for pain medication. He said you can fill this so that following your procedure, if you're in any pain or discomfort, this is a very good pain medication that will help alleviate some of the pain while you're healing. And so I thanked him. We talked again for a little while, and then his nurse came in and brought me into the other room, and Mr. Manley came back in and he did the ultrasound. He put a probe in my backside. I lay down on the exam table, turned over to my left side. He put the probe in, took a bunch of readings on the ultrasound, and said that they would use it as a map to help expedite things when I went in for my procedure. Following that, we talked again for a few minutes. He told me that, don't be surprised if I bleed a little bit after the procedure, that I would probably have to keep the catheter in for a couple of days. He told me that one good way to remove the catheter, he said if I felt comfortable, I could easily remove it myself. If not, I could just come back in and they would remove it for me. But he said there was just a valve that you need to cut. The nurse at the hospital will show you. Once you cut that valve with the scissors, the balloon that holds your catheter in place inside the bladder would deflate, and then you could go ahead and pull it out after about 10 or 20 seconds once the balloon deflated. I told him I didn't think I would have any problem removing the catheter myself. And I thanked him. He wished me good luck, and then I just had about a 10-day wait for the procedure to occur. So on the morning of the procedure, I was told to arrive at Northside Forsyth Hospital in Cummings, Georgia. I was told to arrive 2 hours early. So the procedure was 8:30, scheduled for 8:30, and I was told to arrive at 6:30. So my wife and I got to the hospital a little bit early. I thought I would just walk to calm myself down a little bit and get a little exercise. So my wife and I walked around the parking lot for about 20 minutes that morning, and then we went inside the hospital. The first thing was we went to an office where they had some more papers for me to sign, gave me a little bit more information about the procedure, put a band around my wrist for the hospital, and then one of them escorted me upstairs, up the elevator, to where the pre-op room was. So then I was escorted into the pre-op room. It was a small room, but it was very well appointed. I laid down on a bed. The bed had this very futuristic blanket on top. It was metallic silver, very space age, like I said, and futuristic. It was attached to a hose, and warm air was being pumped into it to keep me warm while I was waiting for my procedure to take place. While I was in the pre-op room, they asked me a bunch more questions, typed some information into the computer, told me that the anesthesiologist would be in to see me soon, and then a nurse was going to come in and run an IV in my arm. So then they allowed my wife to come in, and a little while later a nurse did come in. She put an IV in my arm and said this is what they would use to put me to sleep during the procedure, and also I would probably have an IV drip following the procedure, and also they would give me some medicine to help relax me before the procedure. And so a little while later the anesthesiologist came in, very friendly, very outgoing, very nice. He talked to me for a little bit, told me what we were going to do, about the spinal injection, and also about the type of propofol, the type of anesthesia he was going to use during the procedure. He said he would be there to monitor me along with the doctor, and everything should be good. He said he would be back in about 45 minutes to give me the spinal, and then I just waited in the room, talked to my wife, relaxed, and then the anesthesiologist came back into my room. He asked my wife to leave for a little while. He told me to sit on the edge of the bed. He brought a chair up to the edge of the bed and told me to put my feet on that chair. While I was sitting on the bed, I had my feet on the chair. He told me to hunch over a little bit. He said that they put a little medicine into my IV to relax me, and they were going to go ahead and put that spinal injection, which would paralyze me from the waist down. I don't recall the injection hurting at all, or really feeling it very much at all. Once he was done with the injection, he had me lay back down on the bed, and then gradually over time, I started to lose feeling in my lower extremities. I was completely paralyzed from the waist down. I couldn't move my toes, wiggle my feet, raise my legs, do anything, and everything was numb. If I touched my leg, I couldn't feel anything. So actually, I didn't feel uncomfortable at all. I mean, I was just laying in bed, so I wasn't too worried about the paralyzation feeling. Everything felt okay. I was still really relaxed. The next thing I know, they come back into my room, a couple of people, and they said, we're going to wheel you into the OR now, and Dr. Kriteman's going to do the Aquablation procedure. So they wheeled my bed into the OR, and then using the blanket that I was laying on underneath me, they lifted me up and onto the operating table. The anesthesiologist was there along with Dr. Kriteman. The anesthesiologist said, we're going to go ahead and put you to sleep now, and the next time you wake up, you'll be in the recovery room. And that's all I remember. I have absolutely no memory of the procedure or anything after that. I remember waking up in the recovery room. I was told that everything went well, that I would probably be in the recovery room for another 20 minutes, make sure that I was good and awake, and then they were going to wheel me into my hospital room. And so after about 20-30 minutes, they wheeled me into my hospital room. In my hospital room, my wife was allowed to join me there. I was introduced to my day nurse. My nurses were working on 12-hour shifts. So it was about, I would say about 9:45, 10 o'clock in the morning when I got to my hospital room. And the nurse introduced herself and told me that she would be with me either until I left that afternoon or until 7 o'clock that night. Dr. Kriteman came in very briefly. He said everything looked good. I asked him how much of my prostate he removed, He said about 52% of my prostate was removed, and that he had some more procedures or something that afternoon and would probably be back in to see me later in the afternoon. So during my time in the hospital, I had an irrigation bag that was flowing into my catheter, into my bladder, and coming out the catheter. It was a little bit bloody. My nurse would, every 30 minutes or so, she would come in and empty the catheter bag into a big container and then pour the container into the toilet in the bathroom. And she went in and out doing that for the next few hours. About 3 o'clock, 3:30 that afternoon, Dr. Kriteman stopped back by. He looked at my catheter bag, the irrigation. He said everything looked pretty good. It was a little bit bloody, but he said that's pretty normal. And he said to the nurse, I want you to monitor Mr. Roth for another couple of hours. And if he's doing okay in a couple of hours, I don't see why he can't go on home this evening. So I thanked Dr. Kriteman. I told him I was amazed about one thing. Here I was just recently operated on, and I was feeling really no pain or no discomfort at all. And I thought that was really kind of good. It was just a little bit cumbersome being hooked up to an IV and also hooked up to the catheter and irrigation bag. So my nurse monitored me for the next few hours. Like I said, she kept coming in, changing emptying the bladder bag and pouring it into the toilet. And then once Dr. Kriteman had come back in at 3:30, he decided to go ahead and turn off the irrigation. He either turned it off or put it on a very slow drip. And he said to the nurse, I just want to see how he does without the irrigation running through his bladder, and just to keep an eye on him, and then if he's good, send him home about 5:30, 6 o'clock. So about 5:30, the bag was still kind of bloody, and my nurse said that maybe we ought to stay an extra hour or so just to make sure that things are going okay. And then all of a sudden, I noticed that there was a blockage in one of the joints in the catheter. And it looked like a tissue or some kind of clotting or something like that, and it was blocking the flow of urine. And because I had been receiving irrigation, but also was told to drink a lot, I was drinking a lot of water while I was in the hospital room. My bladder was filling up quite quickly, and it was becoming very, very uncomfortable. So what my nurse did first was she turned the irrigation back on to full flow, trying to flush the clotting or tissue through. But that didn't work. All that did was fill my bladder up even more quickly and caused me a whole lot more discomfort. I was getting a little bit nervous that I might be backing up into my kidneys. She took a syringe with some liquid in it and tried to flush out the catheter joints, but that didn't alleviate or wash through the clotting or tissue either. And so she began to get a little bit upset. So she said, I'm going to go out for just a minute and try to get some help. She left me alone in that room for about 10 minutes. Very discomfort. I was feeling a lot of pressure on the bladder. And then when they came back in my room, they tried a few different things through the valves in the catheter, and eventually they were able to get that clot out in the urine and started to flow again. That's when my nurse told me that she didn't really feel comfortable sending me home that evening, that she thought it would be best that she turn the irrigation back on, and I would probably need to spend the night and maybe go home in the morning. She said, actually, most patients, the majority of patients, spend at least one night in the hospital anyways. So I said that would be fine. At 7 o'clock, she told me goodbye, and the night nurse came in. Now, my night nurse, her name was Kim, and Kim was everything you could wish for in a nurse. I mean, she was very pleasant, very friendly, very patient, very knowledgeable. She was just really great. About 8 o'clock, another clot developed inside or some type of tissue was blocking the joint in the catheter. But she knew just what to do, and she flushed it out immediately. So she was really good at that. She came in and out of my room all night long until about 4 in the morning. She had the irrigation bags going. I think I went through 15 or 16 bags of irrigation. And then about 4 o'clock in the morning, she said, let's turn back the irrigation somewhat to a slow drip, and let's see how your catheter bag looks. Maybe it won't be too bloody. We'll see. She thought that I could probably go home about 7 or 8 that morning. And so after she did that, she allowed me to get up out of bed. She unhooked me from the IV drip. The catheter bag was hooked to a pole on wheels, and she let me walk in the hall for a while. So I got up out of bed and I walked a little bit. She said actually the walking was good because sitting and laying down, you're kind of putting more pressure on the bladder. So about 2 and 3 in the morning, I'm walking the halls round and around and just trying to wait for my time to go home. About 7 o'clock, I bid Kim farewell. I thanked her for everything she did for me. I told her she was so wonderful. I mean, she was everything you could want in a healthcare provider. And I thanked her for the wonderful care she had given me all night long. And in fact, she was so good, a few days later after I got home, I sent an email to her supervisor just expressing my appreciation for the wonderful care that I was given. Anyways, the nurse that I had the day before, she came back on shift about 7:15, 7:30. Evidently, she was having some type of a personal issue that was occupying her mind. So she was just really in and out of my room. She really wasn't giving me any attention. I was told that they did my discharge paperwork the night before, so if I wanted to call my wife, I could just go ahead and go home at 8 o'clock that morning. So I called my wife. She came to pick me up. When it was time for me to go, nobody could find my nurse. So one of the supervisors came in and she said, "I'll walk you down to the car." And so one of the supervisors walked me down to the car. When I got home, I was a little bit taken aback because that day nurse, she was so preoccupied, she just sent me home or left me a bloody mess. And everything looked so bloody and so nasty down there that because it was a Friday when I went home, I thought maybe going into the weekend, I better have somebody at Georgia Urology, just look to make sure the catheter was in correctly and why I was such a bloody mess. And so I called the Roswell office, and they said that, well, you can come and see a nurse at 12:30. They'll go ahead and look at it and make sure the catheter's in there correctly, still seated well, and clean you up, and everything should be fine. So my wife took me over to Georgia Urology about their Roswell office about 12:30 for the appointment. I went in pretty quick, but once I got in there, the nurse said because I was post-op, she said that she was not allowed to take care of me in any way, and that I would have to see Clint Manley, Dr. Kriteman's PA, and then he would be able to help me out. So she had me wait in the room for about 45 minutes, and finally they came in and said, "I don't know, he's kind of busy right now, but he'll see you after a while," and et cetera, et cetera. So they put me back in the waiting room, and I waited about 2.5 hours, and finally I was brought back in to see Clint Manley. His nurse and Clint came in. I mean, again, Clint Manley and his nurse were both wonderful. They apologized for the long wait. They said that actually I was given misinformation, that nurse, although she's gone now, she could have taken care of me and done it. There was no prohibition from seeing me after being post-op. She could have done everything for me. But again, he apologized for the long wait. He looked me over. He said, "You're right. It is a bloody mess. You shouldn't have left the hospital that way." So what he did is he laid me down on the table, and him and his nurse, they cleaned me up really good. They reseated the catheter onto my leg. They made sure that it was anchored properly. He irrigated me 4 or 5 times just to make sure that the bladder was still clear of all tissues and everything like that. And he said that he wanted me to keep the catheter in through the weekend and that I could probably take it out on Monday. And then he says, "You know what? I'm going to absolutely give you a phone call on Monday. We'll talk about it. I'll just want to know, if it's still bloody or not and how it looks. But I'm going to absolutely call you on Monday, and we'll talk about removing the catheter. And if you still feel comfortable, then you'll be able to just remove the catheter on your own on Monday." So I thanked him and his nurse for their kindness and for everything that they did for me. And I went back home about 3 o'clock on Friday. I felt pretty good. I finally got a decent night's sleep. I went to bed early, about 9 o'clock at night, and woke up about 6 in the morning full of energy. I had a good breakfast. I took a quick shower, my first shower in a couple of days, and everything seemed to be going good. In part 3, though, I developed a couple of complications that I'm going to talk about. And so in part 3 of the video, I'm going to talk about some of those complications and what it was like in the days and weeks following the procedure, and also a little bit about my experience with Dr. Louis Kriteman, and we'll talk about those things in the next video. So again, Thank you for listening to part 2 of my Aquablation story, and I'll see you again soon in part 3. So have a good day, and thanks again.